Imagine how it would feel if every piece of your surrogacy journey was managed smoothly. A future where you have a team that communicates clearly, a clinic that aligns perfectly with your needs, and a plan that keeps everything on track. Picture yourself not having to worry about what ifs or the unknowns, but instead focusing on preparing to welcome your baby into your family. That's the experience that you deserve. You're listening to Surrogacy Made Simple with Dr. Alyssa Small-Lane, your host. Welcome back. Today we're going to be talking about one of the most important decisions in your surrogacy journey, choosing the right fertility clinic. The need for a new clinic can come up for different reasons. Maybe you're new to surrogacy and this is your first experience with IVF, or maybe you've been through fertility treatments before and now you need a clinic that fits your surrogacy needs. No matter where you're starting from, finding the right clinic is crucial. It's actually one of the first steps in surrogacy, right? You find it exactly behind research. And if you want to see all of the different steps and phases of surrogacy laid out for you, you can download our step-by-step surrogacy guide. It's totally free and it's in our surrogacy starter kit. I'll leave a link down in the show notes where you're listening right now. But why is picking the right fertility clinic for surrogacy so important? Well, because the wrong choice can lead to delays that make an already long journey to having your baby even longer. And since clinic operations and costs aren't standardized, your results and price tag can vary greatly from clinic to clinic. You don't want to drain your bank account and have nothing to show for it in the end, or blow your entire surrogacy budget just on the first step of surrogacy when there's so much more to go. So, yes, it is a lot to think about, and it can feel like there's a lot of pressure to get this decision exactly right. And let's face it, it is overwhelming, right? Surrogacy is already long and emotionally complex, the stakes are high, and delays and missteps mean adding to your timeline and makes the whole thing feel endless. Not to mention, every clinic has different strengths, and not each of them is going to be a right fit for surrogacy in general, and certainly not a right fit for you. Now, surrogacy is different than regular IVF, and there are some things that you need to keep in mind when you're picking a clinic to help you with your surrogacy journey. When we started out, we were in a small clinic, and it was totally fine, at least in the beginning. Our goals at that time were totally different than our goals when we went to surrogacy. When we first started out, we were trying to get pregnant on our own. It wasn't working, and we needed to figure out what was going on. Surrogacy was the furthest thing from our mind. So, the fact that the clinic had just two main doctors and batched all the IVF cycles to the same date didn't matter. It was convenient since it was in the same medical center that I was training as an OBGYN. But the one huge catch was that they couldn't handle surrogacy cases. So if we had stayed, we would have had to start our research all over again to find the right clinic for us. But quite frankly, it wasn't a good choice for IVF either, because they had one main nurse who seemed to do everything from fighting with insurance to medication teaching to returning phone calls and informing of protocols. And it all rested on her, which created a bottleneck, which led to a delay in insurance approval, meaning we couldn't start on medications for IVF, which meant that we missed an entire menstrual cycle. And because IVF relies on your menstrual cycle and our bodies don't wait, it meant having to push everything back another month. A month after we had already been trying for 12 months, after we had already gone through 6 cycles of IUI. An administrative delay was unacceptable. So I did what I hope you would do too. I turned what would have been a wasted month into a consultation with a new fertility clinic. And while we didn't leave that first clinic because they couldn't do surrogacy, we didn't even know we needed it at that time. We left because the clinic wasn't a good fit for us and what we needed. Now, wouldn't it be great not to find that out the hard way? Wouldn't you rather pick the right clinic from the beginning? I can hear your head nodding. So, today we're diving into 4 things to look for in a fertility clinic when you're doing surrogacy. And we'll go through each one step by step so you'll feel more confident about what you need, what to ask, how to find the clinic that will help you achieve your dream of growing your family. Now, let's dive into the first thing that you should be looking for. Number 1 is making embryos for surrogacy. Let's start with a big question. What if you haven't made your embryos yet? Or maybe you need to make more embryos for your surrogacy journey. Your entire surrogacy journey, which is already long and emotional, hinges on making sure you have healthy, viable embryos. Imagine spending months or even years waiting only to find out that your embryos weren't viable because the lab didn't have the right level of expertise. It's not just about convenience or friendliness. It's about making sure that every part of your journey is set up for success. And that starts with the lab behind your fertility clinic. So, if you're going to be making embryos as part of your surrogacy journey now, then you need to be assessing quality, the quality of the embryology lab, the experience of the embryologist, and the outcomes for patients like you, people with a similar age and diagnosis. When you walk into that clinic, you want to be confident that they have the experience and resources to give you the best shot at success. And while customer service is nice, feeling like you're cared for and seen is important, the number one thing that you need in a clinic is good embryos, period. When it came time for us to do IVF and make embryos for surrogacy, I was super goal oriented. I definitely had the end in mind. I wasn't looking for a clinic that was going to give me the warmest welcome, although a warm welcome is always appreciated. I was focused on getting those high quality embryos that would eventually lead to my baby. In my area, there's one clinic known as the Baby Factory, for good and bad reasons. They weren't exactly known for their bedside manner. You could say they were more about efficiency than warmth. A lot of people complain that when they go there, they feel like they are just a number. But I said to myself, I don't care. I don't care if I'm just a number. They can stamp that number with a barcode on my forehead and put me on the conveyor belt. I'm here for the destination, not the journey. And guess what? One of those embryos that I made at the Baby Factory Just a Number clinic is now my daughter. The takeaway here is that while it's okay to value friendliness and customer service and warmth, and of course you should feel welcome wherever you go for your care, getting good embryos should be an absolute priority. Your goal is to have a baby at the end of the day, and that starts with making sure that you have the best embryos possible. So you have to ask the hard questions like, how experienced is the embryologist? How long have they been with the practice? What are the success rates for people like me? How good is this embryology lab? Having high quality embryos is essential for surrogacy. So, certainly, the number one thing that you should be thinking about when you are looking for a fertility clinic for surrogacy is whether or not they're able to make you good quality embryos. Number 2 is making sure that they can handle third party reproduction. Now, here's something that not all intended parents think about right away, and that's whether or not the fertility clinics that they are picking between can handle third party reproduction. Third party reproduction is the term that's used for surrogacy, egg donation, that sort of thing, because there's a third person involved in the process. Not all fertility clinics do. Some may be smaller programs that simply don't have the resources, or maybe they don't have the experience to do surrogacy well. And an example is definitely that first clinic that I was with. They were okay to evaluate and try to figure out why we had infertility and do IUIs. They kind of struggled with things related to IVF. And they didn't accept surrogacy cases, which I think was totally appropriate because they just didn't have the setup and the capacity to handle it well. Now, imagine if you pick a bunch of clinics like this first one out of convenience or the reputation of the doctor. You schedule a consultation, you wait a number of weeks, you go in, you pay your fees, only to find out that they can't work with surrogates. You've now wasted not a lot of money, but your time, and your time is so important. You could also get in a situation where you are working with that type of clinic already and you've made embryos, and then you discover that you can't use those embryos with a surrogate. Now you have to start thinking about shipping your embryos to another clinic because your first one can't handle surrogacy, which means extra steps, more paperwork, additional coordination, and yes, more waiting. Even if you decide to make embryos at a clinic for convenience, maybe it's cheaper, maybe it's close to work, like my first clinic was, they have an amazing embryologist, or your insurance covers this facility, then you also need to think ahead about what you're going to do with your embryos to be able to get them to a place where you can use them for surrogacy. Shipping embryos is possible. I've done it before a few times, and we've talked about it together here on the podcast. I'll put a link to that down in our show notes. Now, if you're trying to work out one of these more complicated strategies for surrogacy, it's doable. It can just be a lot to handle on your own. It does take some extra strategizing, and we have resources available for that. If you need some help trying to organize that type of surrogacy strategy, we can jump on a call on one of our surrogacy strategy sessions and help you to be able to figure out how to navigate that kind of situation. But if you're just looking for the simplest, smoothest, straightforward process, it's to pick a clinic that can make great embryos and use them for surrogacy both at the same time and not have to worry about moving between different clinics. And the best way to do this is to make sure that your clinic, one, has a great embryology lab, and then two, is experienced with third party reproduction. You want to look for a clinic that has a strong track record of handling surrogacy cases, not just standard IVF. You can ask them how often they work with surrogates. You can ask how many surrogacy journeys they handle each year. It makes a big difference whether the clinic knows how to work with surrogates and has dedicated protocols for third party reproduction. It's a great way to gauge their level of experience and make sure that they have the support to give you every step of the way. The right clinic will make this process smoother, not harder. So, when you're choosing the right clinic, don't forget to ask those important questions. Can they handle third party reproduction? How experienced are they with surrogacy cases? Getting those answers now will save you a lot of heartache and frustration later. Number three, the cost of the surrogacy programs and packages. The cost of surrogacy programs at fertility clinics can be surprising. If you're used to the cost of a standard embryo transfer, you might be surprised to find that the cost of transferring an embryo to a surrogate is significantly higher. If you think you're just doing another embryo transfer, it's just another IVF cycle, you might be in for a sticker shock. And this is because of things like surrogate medical screening, surrogacy surcharges, bundled payments, and surrogacy coordination fees. All of this causes the cost at the fertility clinics to balloon. Sometimes parents are taken aback because it feels like it's coming out of nowhere, especially when clinics are adding on fees just because a surrogate is involved. For example, a transfer that would usually cost $5,000 might jump to $7,500 just for the extra coordination involved. Some clinics justify it by saying they're coordinating between multiple parties, intended parents, surrogates, and agencies. But sometimes that extra coordination is really just CCing an extra person on an email, which makes you wonder exactly what you're paying for. And these little surcharges do add up quickly. So it's important to know about these potential extra costs ahead of time so you can ask the right questions and compare clinics effectively. Here are the big ones to watch for. Number one is surrogacy surcharges. These are additional fees that some clinics charge just because a surrogate is involved. So, like that example, an embryo transfer to you may have been $5,000. Now they're going to add an extra 2,500 because it's a surrogacy case. So ask about those surcharges specifically. Number two would be the surrogate screening package. These costs actually vary a lot from clinic to clinic, so it's one that you should definitely keep your eye on. It might be a few $100s at one place, and it could be a few $1,000 at another place. It's a one-time fee, so it's not that expensive, especially if your first surrogate passes all of the medical checks. But sometimes you have to screen more than one candidate, and that's where costs can add up. One of the things that you can do to help lower this cost specifically is making sure that your candidate is properly vetted, either you doing that yourself or through an agency. That way, you don't have to screen multiple candidates and you're not having to pay the screening package over and over again. Number three is bundled payments. Often clinics will bundle monitoring services like blood draws and ultrasounds that come around the time of the embryo transfer. So, usually, when you pay for the embryo transfer, that's going to also include all of the blood work and ultrasound leading up to it, and sometimes the blood work and ultrasound afterwards, which is nice. It's just a convenient one time payment. However, what if your surrogate lives in another state? She's not going to be flying to your state every other day for blood work and ultrasound. She is going to be going to a clinic closer to where she lives, and the results of the labs and ultrasounds are sent to your fertility doctor. But that other clinic isn't going to be working for free, so you're going to be paying for the ultrasound and blood work there. However, you also already paid at your clinic. So it definitely feels like you are paying twice for a service that you're only using once because you are paying twice for a service that you're only using once. And that's the problem with bundled payments. You may not actually be using all of the services that are grouped together, even though you're paying for them. You can ask your clinic if they're willing to separate out those costs. That way, you're only paying for what you need, but not all clinics are willing to do that. Number four is the surrogacy coordination fee. This fee covers all the work that the clinic has to do to manage the surrogacy process. This is a payment that we've seen increase. More clinics are charging coordination fees, and the amount has been steadily increasing in the past few years. What you're paying for are things like signing HIPAA forms, communicating with agencies, educating surrogates, CCing everybody on emails. And the problem is that these fees range wildly. It can be zero at some clinics, it could be 500, and others are $5,000. So it's worth understanding exactly what you're paying for and figuring out for yourself whether or not you feel that these costs are justified. Understanding these costs upfront can save you a lot of frustration. When you're consulting with different clinics, when you meet with the financial advisors, make sure that you are asking about all of these fees specifically. Make sure you're not just given a generic IVF cost guide. You want one that's specific to surrogacy and has all of the different fees included. That way, you're comparing apples and apples between different clinics. Because it's not just about getting a price quote, it's also about understanding why these costs are there, what they are, and making sure that you're not paying for things that you don't need. The fourth thing you should be looking at when you're judging fertility clinics for surrogacy is who your coordinator will be. Who is going to be that point person? When it comes to surrogacy, you need someone in your corner making sure everything runs smoothly. But not all clinics are set up that way. Some have a dedicated team of coordinators and nurses. Others rely on a single individual. Think back to that small clinic that I had. There was one nurse who was doing everything. So when she was away, had an off day, or was out sick, everything stopped, which means your treatments, your care, your surrogacy journey just grind to a halt. So imagine that happening when you are in the middle of a critical stage in your surrogacy journey, and suddenly your coordinator is out sick or goes on vacation. What happens then? Will everything stop because important information is stuck in that person's email? Or do they have some kind of levels of redundancy or ability for other team members to be able to access, read what's going on, and then continue without missing a beat? The last thing you need is to be left in limbo because your only point of contact isn't available. And then there's the issue of expertise. If your coordinator is juggling surrogacy cases along with other fertility patient types, they may not be able to handle the specific needs and challenges of surrogacy. Have they done this before? Are they up to the challenge? Are they learning on the go? These are things that you want to know and deserve to know. Not all fertility clinics handle surrogacy because it does take extra knowledge and coordination. So you want to make sure that your coordinator or nurse, your point person, is dedicated to surrogacy and the egg donation process, and that they understand it inside and out. Ideally, they should be able to answer your questions, guide you through each stage, and be a valuable resource. If the clinic has a team of coordinators, that's good. It's worth asking how responsibilities are divided and what the backup plan is when someone is unavailable. Just because they have multiple coordinators doesn't mean they work together. Don't assume just because a place has more that you're going to be protected. You have to make sure that when one coordinator is out, the others are able to step in. Make sure that they have a solid plan for continuity of care so that you're never left waiting or feeling uncertain. Also, make sure you know the best way to contact them. That way you can get information or help if you need to in a timely fashion. Choosing the right fertility clinic is about the support systems they have in place, the people that you're going to be interacting with on a day-to-day basis, the ones answering the calls, setting up appointments, and guiding you through every step. They play a massive role in your overall experience. Be sure to ask, who will my point person be? Are they dedicated to surrogacy? Have they done this before? What happens if they're not available? Getting clear answers to these questions can make all the difference in how smooth your journey will be. As you've noticed, I didn't mention anything about the doctor, which is probably interesting for a rundown coming from a doctor and OBGYN like myself. But it goes without saying that you're going to be choosing the fertility doctor that you want to work with. It's important that we highlight these other things that may not be at the top of your mind. Researching and picking a fertility clinic for surrogacy is one of the most important parts of your surrogacy journey, and you want the right clinic for you. Doctor, coordinator, embryology lab, package, the whole thing. There's a lot that should go into your decision, and we went through 4 important things to consider. Do they have what it takes in the back, in the embryology lab, to make the best embryos possible? Can they handle surrogacy, or is this their first go at third-party reproduction? Surrogacy is expensive, and the prices and packages are different at each clinic. How much is it going to cost? Who's going to be your point person at the fertility clinic to help you through these medical procedures and schedules? Embryos, good coordination, and affordability are some of the most important factors that can make or break your experience. Knowing what to look for in a clinic can help you make the right decision whether you're brand new to IVF or if you've gone through this before. Either way, we're here to make sure that your dreams don't get derailed. Imagine how it would feel if every piece of your surrogacy journey was managed smoothly. A future where you have a team that communicates clearly, a clinic that aligns perfectly with your needs, and a plan that keeps everything on track. Picture yourself not having to worry about what ifs or the unknowns, but instead focusing on preparing to welcome your baby into your family. That's the experience that you deserve. Take control of your journey today. If you're looking for more support, check out the resources listed in the show notes where you're listening right now. Your surrogacy starter kit and the step-by-step guide, as well as the Bloombridge surrogacy app, take the guesswork out of surrogacy. Thank you so much for sharing your time. This has been amazing. You're so close to something beautiful.